My name is Dr. Brianna Willie, and this is my channel, Business for Nerds. Why did I name the show Business for Nerds? Because I'm a nerd. I enjoy and love sci-fi, video games, reading, fantasy. I'm reading the Wheel of Time series right now. I also love to talk about all things business as I'm learning and I want to grow and collaborate with other business owners. So, welcome, business nerds. I'm interviewing entrepreneurs so we can mutually support each other in business. Today, I'm talking with Dr. Stacy Greeter, who runs her own psychiatry private practice of the same name. She provides psychiatric assessment, medication treatment, psychotherapy, as well as education and advocacy. She's going to talk about her business and the services she provides. Hi, Dr. Greeter. How are you doing today?
Hi, Bree. Do you go by Bree or do you go by Dr. Willie while we talk?
Call me
Hey,
Bree.
Bree. Oh, okay, cool. It's great. It's great. I have known Bree for quite a while. Like I think one of the first therapists I met when I moved to town. So it's very exciting. I've been here for about 6-ish years. So I love being a psychiatrist. I see kids and adults. I get to do some psychotherapy as well as medication.
Mhm.
And I love teaching other people psychiatry. I'm super passionate about teaching other clinicians how to do psychiatry so that we can improve access to good psychiatric care.
Mhm.
And I am autistic and ADHD. And my special interest is decreasing stigma through my own disclosure. And one of my special interests besides psychiatry is fantasy creatures. So I do make fantasy themed, I call it psychoeducational fan fiction, psychiatry presentations.
Ooh.
The most recent one was a Lord of the Rings presentation where the dragon Smog from The Hobbit is struggling with hoarding and existential OCD fears and also sexual orientation OCD fears.
Mhm.
And I also did a Harry Potter themed one on autism, for example. So
Mhm.
I'm really excited to be here as a fellow nerd. Thank
Yes. Hi. So you're already going over a little bit about your what you're interested in,
Yeah.
fantasy. I love it. LOTR, that's my favorite movie. Actually, I saw it 20 times in the theater, no joke.
Okay. Okay. Well,
So,
have you seen like you can use this with clients. My husband does the voice acting for my presentations. So he does an amazing Smeagol impression.
oh,
So you can use the recording of Smeagol's OCD lies in the voice of Smeagol with your patients.
oh, that's so cool. That's so neat. And I see that we can see your presentations on your website
Yeah.
and you have the
hmm
video
Yeah.
and
If you go to the psychiatry bootcamp section of stacygreetermd.com,
that's
spelled
so neat.
STACYGREETERMD.com.
I love that. I love how you give, you're just giving these things to people so they can learn. I love that. Can you tell me more about how were you inspired to do that?
How was I inspired? Oh, it's kind of a funny story, I think. I teaching for the family medicine residents who rotate with me from
Hmm.
Manatee Memorial Hospital. And they, so I was teaching and they were like, hey, the presentation, we want it to be on bipolar 1 versus bipolar 2. And I thought that that wasn't very useful. I thought it
Hmm.
was more useful for them to be learning how to just distinguish if there was any bipolarity period to refer and then, treat more ADHD and depression. Anyways, so I started originally psychiatry boot camp because I wanted to present on whatever I wanted to present on that would be most useful to people. And then it just grew from there. Get
Hmm.
a lot out of it in terms of, I mean, I learn and grow as a psychiatrist so much each time I do a new presentation and do
Hmm.
another deep dive in a new area.
Hmm.
And that's part of my autistic neurotype. We emotionally regulate by doing deep dives into our special interests.
Hmm.
So it's also rejuvenating for me. to keep
Mm-hmm.
doing that.
Good. So helping manage or reduce the risk of compassion fatigue through
Yes,
doing that.
yes,
Mm-hmm.
yes.
I
There's a
love that.
quote. There's a quote, and it's I wonder which book it came from, but it is on compassion fatigue. I think that the new is what brings renewal.
Ooh,
So learning new things in your area of clinical practice is a technique for reducing burnout and compassion fatigue.
I love
And it
that.
is something that I think also additionally, learning new things helps us shift our focus to what's within our control, i.e.,
Mm-hmm.
our knowledge base and our competency as a practitioner, instead of
Mm-hmm.
what's outside our control, like whether or not our patient decides to stop drinking or whether our patient is happy with us.
Ooh, I love that you brought those connections, the things we can control versus the things we
Yes,
can't. And this is like a compassion fatigue
I
management
know.
strategy. Love
It
it.
is because I mean I find that that felt sense of inadequacy when our patient's suffering is persistent, gets worse, or we have to, or we're, the subject of our patient's anger, the subject of, our patient's sadness. That's extremely painful.
Mm-hmm.
So things that we do that help us focus back in on what's within our control and like, hey, it's not up to us whether or not our patients get better. Ultimately, we
Yes.
have we have an impact, but ultimately the patient is the biggest factor that determines whether healing happens is the patient, and we take ownership of whether we show up professionally and compassionately.
Yes. So we have the control over in the sessions, we're showing up, we're there, we're
Yes.
listening. And they often say the relationship with the patient is the most important part of therapy. But then going back
It's
to that emotional
yeah,
boundary you're setting, that
yes,
ultimately it's up to them to make those choices to move forward. We don't have control over that.
yeah, yeah,
Hmm.
and letting that go, that's hard. I think of like we hold a door open, but we don't drag them through it.
Right. Gentle. And we
And
don't
that's
want
hard.
to. That's not going to help them
I
if
mean,
we
it's not
drag
it's
them
not
through.
it's not. They are going to drag us in the opposite direction. Yes.
Right. Yeah. Yep.
Towards
Yep.
what's going on with them.
Yeah.
Yeah, we
Mhm.
just hold the door open for them.
I like that.
I know that's hard.
It is. We provide those resources. If they take them or not, that's up to them. So you've already gone into a lot about compassion fatigue in your work. You also present
Mhm.
to, are you okay with talking about presenting to others about compassion fatigue and what you do there?
I have presented to other psychiatrists
Hmm.
about compassion fatigue.
Hmm.
I recently did a grand rounds presentation for Sarasota Memorial Hospital. I named it the heart sync patients after the patients who you see them on your schedule and your heart sinks. We know who they are.
Okay.
um,
Hmm.
to help clinicians. And I would say that, another important message that I try to impart to other clinicians, especially physicians who we kind of get brainwashed a little bit in our medical training that we're not supposed to have feels,
Mm,
is it's extremely healthy when you feel frustrated, angry, sad with your regarding your patient. It is actually a healthy reaction if you are dreading seeing that patient, and it is more helpful to lean in
mhm,
and ask yourself, how does this feeling make sense?
mhm,
What is
mhm,
going on?
mhm.
Um, and allow yourself to feel that anger so that you still have the agency to make a choice that isn't controlled by those feelings.
Ooh, I
I
like
don't
that.
think we're taught that, unfortunately, in the medical profession a lot, you
Right.
know, because our
Yeah.
instinct when we're like, oh my God, I don't want to talk to this patient, is I shouldn't feel that way about my patient.
Yeah, the
But
shoulds.
that
Mhm.
That's human. Instead of be like,
Mhm.
okay, why? How does it make sense that I'm dreading seeing this patient? Like, what is going on here?
Right. That managing, and I talked
That's
about this.
valuable. Yeah.
Yeah. My dissertation was partially inspired by you and your work with
Aw,
compassion fatigue. It was.
that's
Um,
really cool. You have to send me your dissertation so I can read it.
okay.
I
There's a
know, in my
link to
copious
it.
free time, right?
I know. There's a little summary of it. Anyway,
Okay. All right. All
I
right. All right. All
digress.
right. I'll read the summary.
Let's see. So you inspired that partially, and also what I was seeing in myself, and also what I saw in others, other
Mm-hmm.
therapists, other helpers with our own struggles. And yes, the feelings we get as therapists, the tough stuff we hear. But anyway, going back to your talk about countertransference, you're talking about
Mm-hmm.
managing that. And Yalom talks
Mm-hmm.
about that it's okay to feel. We need to look at why are we feeling this way?
Things are
Examine it.
messengers. There's a saying he has, symptoms are messengers of a meaning that will only disappear when the message is received. That's a
Ooh,
Yalom quote, by the way. That's from the
wow.
book When Nietzsche Wept.
Ooh, I haven't read that
Anyways,
one.
I like it.
Mm-hmm.
Yeah, it's a fictional story about Freud treating Nietzsche, I think. Anyways, yeah. Yeah, it
Oh.
said symptoms are messengers of a meaning that will only, I might be misquoting it, will only disappear once the message is received. And not all symptoms, of course, but I think we
Ooh.
can view our feelings as very important messages, sort of like a psychological physical exam of a patient, how we feel
Mm.
about them.
Okay.
I found it. This is in my psychiatry Jedi presentation. There you go.
Mm-hmm. Oh, it's
That was
okay.
it. Perhaps
Okay.
symptoms are messengers of a meaning and will vanish only when their message is comprehended. That's the
Ooh.
Yalom quote from When Nietzsche Wept.
Oh, and I love the picture.
I don't know if you've seen this one, but it's good. And my husband's Yoda voices are really good too. And then there's a good one about empathy in here. Where is it? I'll find it. I guess there's a lot about empathy in here.
Oh, cool. Oh, I like this. I'll have to read this
You like
over.
it?
Mm-hmm.
Yeah. This is about emotional boundaries. Callous,
Mm-hmm.
loss of empathy, emotional over-involvement, loss of perspective.
Mm. Interesting. It's so
It's also about
good.
how we cultivate empathy. All right, I guess I didn't
Mm-hmm.
find it. It was like uh, some quote that says, "Empathy is a double-edged sword. It is both our greatest um, asset and greatest vulnerability."
Ooh, yes. And I think that plays into compassion fatigue too. We have this great
Yeah,
empathy, but it also has that other side to it that it could hurt us if we're not careful.
yeah, yes.
Interesting.
Yeah.
So cool. Let's see. So you've already talked about strategies for managing compassion fatigue. You already gave us a few coping strategies. Anything else you want to share about compassion fatigue or how you help or
Yeah, I really want to normalize it. I
Mhm.
really want to dispel a myth that if you're doing everything right as a clinician, that you don't get burned out and you don't experience compassion fatigue. I
Mhm.
I don't think that's correct at all. I think
Right.
that this is a very healthy way that there's I see it like a seesaw where you go into compassion fatigue and then you right yourself and you go into it again and you right yourself in a
Mm.
continuous balancing act
Mhm.
because we cannot be fully present with other people's emotions and leave unscathed. Um,
Ooh, that's powerful. That is. I'm going to
yeah.
quote that. That's
Okay.
good. Say that
Yeah.
again. We
Yeah. We
cannot.
cannot be fully present with other people's emotions and leave unscathed. It's
Ooh.
it's part of the work. It's part of the work. And so I think instead of saying, yeah, I'm never going to have compassion fatigue. I think just, or I'm never going to be angry with my patient, right? Obviously, never going to dread coming to work and feel bored and distant while I'm talking to my patient who's crying. No, it's going to
Mm,
happen to us. It really is.
yeah.
And so to notice it and then figure out how we can get that renewal,
Mhm.
whether it's backing down on a certain type of patients and recognizing our limitations in terms of which type of patients we treat, which ones are going to drain us the most, which ones are going to sustain us the most.
Mhm.
Or is it getting consultation? Is it changing up what we're doing? Is it
Mhm.
venting to a really non-judgmental peer?
Mhm.
What are your favorite ways, Bree, of handling this when you're getting into that place?
Yes, a good question. I like to recharge with maybe get into another scene, like outside, some yoga,
Yeah.
move my body. Those are some quick things I can do. And I want to normalize too reaching out for help, like you just addressed, reaching out to a peer, consultation, therapy.
Mhm.
I go to my own therapy when I need it,
Mhm. Yep, me
you
too. I
know.
go every week.
Mm-hmm. Good. Yeah. You also, I wanted to ask you about this too. You also lead a
Yeah,
book club
I do.
I love that. I love
And
it.
that helps. Yeah, I have a mental health professionals book club, so
Hmm.
people can email me if they want to join. It's once a month on Zoom. This month
Hmm.
we're reading Get Out of Your Mind and Into Your Life, Acceptance and Commitment book by Stephen Hayes.
Oh, okay.
Um,
Yeah.
yeah.
Good.
So I think paying close attention to the aspects of your work that build you up and
Mm-hmm.
the aspects that drain you and
Mm-hmm.
trying to titrate that stuff as much as you possibly can. I mean,
Right.
Brie and I, we're privileged in private practice in a lot of ways
Mm-hmm.
because I have autonomy
Mm-hmm.
over which patients I treat, how long I spend with it for an appointment, if a patient needs a 45-minute appointment or an hour or 90 minutes. I'm so grateful for that autonomy that
Mm-hmm.
a lot of clinicians and physicians don't have.
Right.
Yeah.
Right. That's another piece I'm working on is teaching other therapists how to start their own private practices if they want to add that autonomy. Again, it's not easy. And I wanted to ask you, you started your own
hmm
practice here.
I did.
Can you share with us some ideas on how to build a successful private practice, or maybe just a thought? It doesn't have to be all the things.
Okay. Okay. Because I don't feel like an expert on this, right? How to build a successful private practice.
Hmm.
Um, Figure out which patients you love seeing the most. Learn as much as possible um, about
Hmm.
that area. Do continuous learning in that area. Continuously, I think curiosity and ongoing learning is one of the most vital assets to being successful in our field.
Yes.
Um,
Hmm.
and so on top of that, I think I think good administrative support can be really helpful too in terms of delegating tasks that may drain you.
Yes.
Um,
Hmm.
and that's really key for me.
Yes.
I also would say that I think every time I have a new patient, if there's I will send my assessment. I automatically ask for a release of information to send the assessment to the therapist and will not hesitate to reach out and leave a voicemail. It's
Yeah.
very hard to find, a time when the stars align and you and another person might be able to talk at the same time. But I'm a big fan of an exchange of detailed voicemails at people's convenience, which isn't very time consuming, or an exchange of notes so that
Hmm.
you a are improving patient care because there's communication
Hmm.
between multiple providers, the prescriber and the therapist, and b are improving your referral source network at the same time.
Right, which is important with running a successful
Yeah.
private practice. Networking,
Yes.
referrals.
And then other people can learn about the kind of referrals you're looking for. Yeah.
Win-win.
So I
Yeah.
would say tell people, be like, my favoriteest patients I get the most excited to treat are ... Yeah. And really be, don't be shy.
Yeah. Okay, that's great advice. I love that. Was there anything else you wanted to tell us about your business or things you provide or things that are
Yeah.
coming up?
Well, I have 2 psychiatric PAs and they are
Mm.
awesome. Okay. And they're a great deal because they cost about half my rate. We don't take insurance. So sorry. They cost like half my rate and just as much time with you. And they're amazing. And I'm, on an ongoing basis discussing cases with them. Bethany and Kira. Kira and I only see patients in Sarasota, and Bethany is seeing patients in both Sarasota and Tampa.
Oh, I saw that. You have another office.
Yeah.
That's so cool.
Starting that. We do take students a lot.
Mm-hmm.
And also provide supervision and consultation for people who want to, psychiatrists who want to learn more, or therapists. I could do that too. And I have additional training in motivational interviewing, internal family systems therapy, psychodynamic psychotherapy, ICBT, various areas. So I really love combining medication and psychotherapy. Oh, and I'm doing a presentation tomorrow about being autistic that I'll send you
Okay.
the information from. There'll be a video. I know they're going to
Okay.
record a video.
Nice. Okay. Is there anywhere they could
Yeah.
access it?
So anyone who wants to receive presentation recordings or updates on presentations in the future can email me to get on my email list. It's stacygreetermd.com, which is spelled STACYGREETERMD.com.
Yeah,
Yeah.
cool. If you would like to contact Dr. Greeter, reach out to her at www.stacygreetermd.com. Please send me an email at drwilly@attainablevision.net, or you could check out our websites. The one for therapists is attainablevision.biz. For general businesses, attainablevision.com. For therapists or other helpers who want to add coaching, attainablevision.courses/professional coach. And check out our Facebook groups, Attainable Vision for Private Practice, that's for private practice, the Professional Coach Directory for coaches, and Dr. Willie's Business for Nerds. Let's build your business vision, and that is for all businesses. Thank you for listening, and I hope you have a fabulous day. Bye.